Hi, I'm Matt Oerding, joining from Boulder, Colorado today. I'm incredibly excited to be part of OIS Myopia. I've spent the last 20 years in the eye care industry in strategic and marketing roles around the world, but I've had a passion for myopia management for the last 15 years since I first started working on a project with Brian Holden, where we were trialing soft contact lenses for myopia management in China. I'll be talking today about the role of myopia management globally, where it's at, what's the market opportunity, what are some of the issues and opportunities that will help move us forward to create a category and help the millions of kids out there that need and deserve myopia management treatment. My presentation really focuses on an opportunity to change lives for generations of kids through myopia management treatment. A couple quick disclosures. I am the co-founder and CEO of a company called Treehouse Eyes. We partner with eye doctor practices to help them implement and market myopia management in their practice. I'm also the past board chair and a current board member for the Global Myopia Awareness Coalition, or GMAC. GMAC is a group of 15 companies and associations that have been working together for the last 2 years to promote public awareness of childhood myopia and myopia treatment options to really help drive this category and collaborate as an industry to increase awareness amongst the public. I always like to start with my why. So in my case with myopia management, my why starts, as it often does, with my kids. So this is my now 11-year-old Kate when she was doing a video last year when she was 10 years old. So Kate started becoming myopic between about the ages of 8 and 9. Of course, being in the industry for a long time, I take Kate in every year to the optometrist for her eye exam. And given our risk factors and her risk factors for myopia, my wife is -6. Kate spends a lot of time indoors, reading, loves to read. We started taking axial length measurements to measure the length of her eye when she was 9. When Kate became myopic toward the age of 10, she was a low myope at that point in time. We started atropine treatment for her, and we've been monitoring her every 6 months since, and she's now 11 years old. The myopia treatment has been working. We believe it's slowed down her progression, but she's almost 24 millimeters from an axial length perspective. She's now a -150, and as you can see, she needs glasses full time. And we're getting ready actually to change up her treatment and get a little more aggressive with some overnight contact lenses. So Kate's fortunate. I know about myopia. I know about myopia management. I know the impact it can have on her life. So every day I wake up and I'm thinking about how we help kids like Kate, who maybe their parents don't know about myopia management. But I try to keep all these kids in my mind every day as we think about how we grow this category. Half of the world is going to be myopic by 2050. You'll see this slide a lot. Almost 5 billion people are projected to be myopic by 2050. And importantly, almost 1 billion of them will have high myopia. The key message here is not just the growth, but it's more than just high myopia. Every diopter matters as we're talking about myopia management, and there really is no safe level of myopia. So we want to treat every child, if we can, even those low myopes, and especially those low myopes, before they become highly myopic. And when I talk about treatment, what are we treating? What is this disease? So simply put, myopia is where the eye is growing too long. So as I talk about axial length and the length of the eye, a lot of people that have been in our industry for a long time think about myopia as simply blurry distance vision, but really that's the symptom of the issue. What we're really treating is an eye that is growing too long. And though glasses and regular contact lenses are wonderful, all they do is help the child see. They don't really treat the underlying disease, which is an eye that's growing too long, which is really what is the focus for myopia treatment. When we talk about myopia management, we are talking primarily about kids. And as you can see in this 2018 AOA IQ study, 75% of kids are diagnosed with myopia, if they have myopia, between the ages of 3 and 12. So that's really the sweet spot. It's oftentimes preschool and school-age kids where myopia is first diagnosed. And we know from a lot of the clinical studies that treatment is most effective if we're able to do it when a child is younger. So really that 7 to 9 years old is a sweet spot. But even in our treehouse eye centers, we see kids as young as 4 years old that we have in myopia treatment. The next question about myopia for those that have been in the industry for a while is so what? Glasses work great. Contact lenses work great to help compensate for blurry distance vision. Well, this chart and ones like it is the so what. The reality is that eye disease risk, and you can see several of them there, is increased dramatically the more myopic you are. And so that's really the axial length of the eye growing too long is driving that disease risk. So we don't want to wait until a child is -4 or -6. We do want to initiate treatment as soon as we possibly can. And you can see the impact we can have if we can slow down that myopia progression, or ideally even stop it completely. We not only help the child have better vision for their whole life, but reduce the risk of serious eye diseases for their lifetime as well. I want to talk a little bit about the market. So the market for myopia management globally currently is very small. It's probably less than $100 million in sales globally. But what is the market potential is the real question. So you hear me say total addressable market. This is the market that we believe we could reach through eye care practitioners and that consumers have disposable income to be able to afford. So if you look at this chart from left to right, there's about 1.6 billion children globally, and this is today, according to the World Health Organization. And that's school-age children between about ages of 6 and 17. If we just look at the myopia studies on kids around the world, we've got about 360 million myopic kids out there today. When we then take that to addressable, meaning they have access to an eye care provider who can provide myopia management treatment, we get about 55 million kids out there today that are an addressable market for myopia management, which is significant. Importantly, as we look ahead back to the chart about 2050, that market, that addressable market, is going to grow to almost 300 million children by 2050. So because of that increasing incidence rate, and with more products available to treat myopia, we're going to see a massive explosion in the addressable market for myopia management over the next 30 years. I like to always take patients into dollars. So what does that mean from a dollars perspective? Today, at a cost of $1,000 per treatment for every myopic child, we already have an addressable market of $55 billion US globally. So that's billion with a B. So already the market today in terms of what we should be addressing is massive. But if we look ahead to 2050, we're talking over $200 billion. And both of these numbers are conservative. In most markets and most practitioners actually charge much more than $1,000 per patient for myopia treatment. But being conservative, we already have a huge market need and opportunity, and it's going to grow rapidly. I often like to compare myopia management as a category to orthodontic braces for kids. That's a category that has a lot of similarities. You've got to educate parents. The treatment is done on children. It's often private pay. Insurance covers very little of pediatric braces. And it's a market that's been created in the last 30 to 40 years. If you look at the global actual market for pediatric braces today, it's $40 billion. That's smaller than the addressable market for myopia management today. So already we have a bigger opportunity than pediatric braces. And because of the increase in myopia incidence that we know is happening and going to continue to happen, the market potential for this market is actually that much better. So what are some of these treatments that are available today? You're going to hear a lot of our speakers talk about some of the different technologies out there, but just to give you a little bit of grounding, there are 4 that are most commonly used to treat childhood myopia today. You've got soft contact lenses. These are typically multifocal or dual focus or extended depth of focus designs worn during the day by the child and taken out at night. You've got overnight wear rigid gas permeable or RGP contact lenses, typically put in before the child goes to sleep. They sleep in these lenses while they reshape the cornea. They wake up and take them out. The added benefit of this type of treatment is the child doesn't need any kind of vision correction during the day. Atropine is a prescription drug, often delivered as an eye drop at night for the child for myopia treatment. And last, we've got spectacle lenses that are used in several markets around the world where they have an indication with special designs specifically to slow the progression of myopia in kids. So again, when we talk about myopia management treatment, what we're talking about is slowing the rate of growth of that axial length. So there's a lot of areas to focus on in terms of market potential. So it may be great that there's 55 million kids out there globally that are the total addressable market today, but how do we reach them? How do we get to that market potential as quickly as we possibly can and help these millions of children? So the first area is public awareness. Right now, that is incredibly low in most markets. China and Singapore in particular, the government's doing a great job of awareness, but in most markets, this is still a big need. That's why we created the Global Myopia Awareness Coalition 2 years ago and really started efforts in the US to start that public education, because I will tell you in our Treehouse Eye Centers around the country every day, we hear from parents, why haven't I heard about this before? Why hasn't my pediatrician or someone talked to me about this? So we've got work to do to increase public awareness of myopia as a disease, but also a treatable one in kids. The second area that there's a lot going on, which is exciting, is regulatory approvals. So right now, soft contact lenses, there are some approved specifically for myopia management in different markets around the world. There's more to come. In the US, currently only MiSight is FDA approved specifically for myopia management. The overnight RGP lenses in Europe, Menicon and CRT have some regulatory indications for myopia management. But in the rest of the world, this is mostly an off-label use of that type of lens. Atropine is not currently approved anywhere in the world specifically for myopia treatment, but there's several studies underway that were really helpful to get that data and be able to get atropine-based products available through regulatory bodies with the proper approval. And spectacle lenses, again, like soft contact lenses, there are some available in different markets around the world, specifically with a myopia indication, but not in the US yet. So we've got work to do, and the companies are working on this with studies to make sure we get the regulatory bodies specifically approving these products for myopia treatment. Eye care practitioner education is really critical to this. So I differentiate that there's the clinical education, which I think we're doing a pretty good job of in many developed markets. So giving optometrists, ophthalmologists, and even students learning optometry and ophthalmology, giving them the clinical skills to perform this type of treatment. But they also need the business and marketing skills on how do I talk to parents about this? Given that low public awareness, that's a really key factor that we need to continue to educate eye care practitioners to help them implement this in their practice. The last key area I believe is really critical is industry change. And what I mean by this, I've been in this industry a long time. 20 years in this industry, glasses and contact lenses are the way we treat myopia, and that's been the way for decades. We've got to get all of us thinking differently about myopia. It's not just about an inconvenience of blurry distance vision or a refractive error. It's a disease where the eye is growing too long, and we can now treat it. We have proven methods, and we should be treating it. It should become a standard of care to offer this to every parent who has a myopic child or who has an emerging myopic child. So I think there's a lot of mind shift change that has to happen in terms of how the industry and the associations think about myopia. The good news is we don't have to figure all of this out by ourselves. There's a couple great examples over the last 40 years of healthcare categories that have been built from scratch or really augmented. So 40 years ago, huge campaigns to change the way Americans and people around the world have thought about oral care. So the brush your teeth twice a day, visit your dentist twice a year campaign was run by the American Dental Association with industry support to really change consumer behavior and drive better oral care. Wildly successful, and I think there's a great model for us to look at there. And then also the HPV vaccine, which is more recent. I think industry did a great job of educating parents in particular about the importance of this and the accessibility, and then giving doctors the tools, especially pediatricians, to have a conversation with parents about why they should be thinking about the HPV vaccine for their child. So as we think about category examples like this, where you've got to build new categories, I think there's 3 key lessons we can learn that are relevant for myopia management. Number one is industry cooperation with effective messaging. So how do we work together to build the size of the pie? So through industry events like this, through the Global Myopia Awareness Coalition, I was glad to see AOA, the American Academy of Ophthalmology's Myopia Task Force. There's a number of industry initiatives to drive more work on myopia messaging, and just making sure that's a coordinated effort to make sure we've got an effective message that we're delivering to the public. The second key lesson is thinking about payers strategically. So currently, myopia management is private pay, so the payer is the parent, but also thinking about what role does managed vision care have here? What role, if any, should medical insurance have? So how do we make myopia treatment more accessible for more people, especially as we look at markets outside of the US? And the third piece of this is that practitioner education, again, on the clinical side, but also on implementation. And that's the piece that we often forget, is we feel like we've trained the eye care professional on the clinical piece, but we haven't given them the tools to really help in terms of driving that in practice. So I've been glad to see a lot of companies starting to focus on that as part of their efforts on myopia management. One thing I would love to share is a parent's perspective about myopia management. So in our Treehouse Eye Centers around the country, we see parents like Seema here in this video with her daughter, Sienna. And this is just a short video I'm going to share where she talks about that journey, about why myopia management and investing in that for her child was so important for her, and how shocked she was when she found out that she could make a difference in her daughter's life that wasn't available to her when she was a myopic child. So enjoy this.
My name is Seema. I have 3 kids, 16-year-old twins and a 10-year-old. And I'm nearsighted. My husband is nearsighted, and I've been nearsighted since I was very young, maybe 6 years old, 7 years old. So familiar with it. And also, all 3 of my children are also nearsighted. I noticed that Sienna was nearsighted when she was about 8 years old. She was squinting and she couldn't see the board at school anymore. And I could see that she just wasn't able to see clearly. Me being nearsighted and my husband also being nearsighted, we expected that our kids would be, but I was sad to still find out that they were. But we knew that it's a correctable problem. So, but we're still, you always hope for the best. I first heard about Treehouse Eyes from our optometrist that we go to every year. Every year I ask, is there something we can do to keep these kids' prescriptions at bay? They've always said no. And this year she gave me this coupon with Treehouse Eyes written on it. Our first visit at Treehouse Eyes, I was shocked to learn that there was something that can be done about nearsightedness, because I never thought you could change the shape. The way your eye grows is the way your eye grows. You can't really fix that other than, laser surgery. So I was shocked to find out that there was treatment like this, and I was very, very happy that we could do something for my kids. The advice I would give to other parents is start early, and the success rate here is amazing, incredible. So there's no losing in just coming in and trying it.
So I want to wrap with leaving you with this thought. Millions of kids out there don't just need our help, they deserve our help. We have an opportunity to really make a generational shift change in public health for these children. So we've got a fast-growing disease. We've got 55 million addressable kids now with the tools we've got in the toolbox today. So we shouldn't be talking about myopia management as just something in the future. We have proven solutions with well-done studies on a number of different non-surgical treatments for these problems that we can train eye care professionals to deliver today. And the great news is we've got willing payers. So parents will invest in myopia treatment for their child, if you know how to talk to them about it, and if you can explain the benefits, not just for their vision today, but their eye health for their entire life. And this last point is one that I think is part of that industry change that we have to overcome, is thinking differently about what people are willing to spend their money on. Just like orthodontic braces, which in the US cost over $5,000 on average, parents will invest in this for their child to make a difference for their life. I want to really thank you for your attention, and I'm excited about our panel discussions and being part of OIS Myopia. Having attended OIS a number of times in the past, having a specific focus on myopia, I think is fantastic. You've got my email address on here. If there's anything I covered that you've got questions about, feel free to reach out, and our website address as well if you want to learn more about Treehouse Eyes or the Global Myopia Awareness Coalition.